Hi, I'm Dr. Prabodh Kumar. Today, I would like to talk about the cause of pain in osteoarthritis and also the role of osteoporosis in causing pain at knee. As you all know, osteoarthritis knee is one of the most common forms of arthritis and a leading cause of knee pain and disability, which can deteriorate a patient's quality of life. If you still think osteoarthritis is a degenerative disease of articular cartilage, I would like to say it is a very rare disease as articular cartilage is avascular, lymphatic, neural, and resilient tissue, and is a tougher structure than bone, which can be affected, if at all, by any means. It will be only secondary to change in bone and its supporters. But cartilage never get degenerates on its own due to old age. Osteoarthritis knee is not a disease of single tissue, that is articular cartilage, but it is always secondary to the failure of some tissue of the knee joint like bones and muscles, but not due to the degeneration of articular cartilage to begin with. The truth is, progression of joint failure is due to our persistent overemphasis on articular cartilage as a major focus of osteoarthritis damage. So, I would like to say that osteoporosis and sarcopenia are the main causes for the pain at the knee in osteoarthritis. Here you see this is a normal bone, the density of the bone, and as age advances, the bone becomes so thin due to osteoporosis. And this thin trabeculae may likely to collapse when the muscles won't support the bone. This osteoporosis and sarcopenia, they are interlinked. Muscle can contract with good tone when bone is strong enough, and when the bones are porotic, muscles cannot contract effectively. Osteoporosis and sarcopenia indirectly weakens the joint integrity. Load bearing capacity of joint depends on strength of the bone and strength of the muscle. Most of the shock absorption is provided by the subchondral metaphyseal and diaphyseal bone and the periarticular soft tissues, especially muscles but not the cartilage. Subchondral bone plays an important role in mechanically and metabolically supporting the articular cartilage and absorbing shock. Subchondral bone, the trabeculae, has bone marrow houses mesenchymal stem cells with chondrogenic potential. One most important thing is subchondral bone attenuates about 30% of loads through joints, while cartilage attenuates only 1.3% of them. Here you can see clearly the subchondral bone is now healthy here, whereas here it is collapsed and is sclerosed and necrosed. The most important quality of subchondral bone is viscoelasticity. The normal subchondral bone is viscoelastic, the fluid phase is the bone marrow. Due to osteoporosis, the subchondral bone becomes thin and collapsed, and further it becomes sclerotic. Sclerotic subchondral bone is not viscoelastic, and overlaying cartilage loses its nutrition, and cartilage breakdown may start. You can see here the sclerosis of subchondral bone, and so because of sclerosis, the cartilage may not get its nutrition. So here I would like to say that cartilage damage was preceded by subchondral bone collapse. Excessive loading of a joint, especially repetitive impulsive loading, will lead to a fracture of the subchondral bone before it produces obvious damage to articular cartilage. So microfractures that heal with microcallus are evident in the subchondral trabeculae. Increased density of the subchondral bone may occasionally be the first radiographic finding in osteoarthritis. This X-ray of X-ray knee APU shows clearly the sclerosis subchondral bone, and here you can see the lateral condyle is convex and healthy with the support of the fibula that is forming the proximal tibiofibular joint, whereas the medial tibia has no support and is getting collapsed and is almost reduced to a small triangular shape like a beak. So here the subchondral bone is sclerosed, subchondral cysts are formed, osteophytes are formed. So the main change is in the condyle due to porosis, not in the joint space. Here the normal X-ray shows the space is very good, no subchondral sclerosis. Both the condyles are in convex shape. When you come to this view, you can see that the thinned out subchondral trabeculae, they collapse and lead to subchondral sclerosis, and the convex shape of the medial condyle, it becomes straight and became concave like this. So under other osteophytes formation and joint space looks narrowing and subconscious are formed. But this narrowing is not because of this cartilage damage, but it is because the change in this condyle and also the change in the tibial plateau. Here I would like to show one example. So she is about 55-year-old lady suffering from knee pain, and the X-ray shows there is severe the narrowing of the space, medial compartment space, and osteophytes are formed. Naturally, we think it's a case of severe degree of osteoarthritis, and the patient was advised totally replacement. When we taken Rosenberg view, this is so this same X-ray looks like this. So what we observe here is the subchondral sclerosis is there, osteophytes are there, but the space is still looks good. The main change is observed in the medial condyle of the tibia. So the most important task of the examiner is to determine the source of pain based on the patient's complaint about the knee. So as articular cartilage is aneural, lymphatic, avascular, joint pain in osteoarthritis must arise from other tissue structures, not from the cartilage. So what could be the cause of pain? It may be from the stretching of the nerve endings in the periosteum covering osteophytes, or sometimes maybe due to irritant synovitis, that is patchy synovitis that may give rise pain. Sometimes there may be microfractures in the subchondral bone due to osteoporosis. Sometimes the stretching of the joint capsule due to joint instability. And the other main cause is the subchondral cirrhosis due to healing of microfractures resulting in intramedullary hypertension or intraosseous tension, which is a major cause of pain in osteoarthritis. So remember, a very important point to be remembered is all the knee pains are not due to cartilage damage, but because of the bone pain or from the other like muscle fatigue or maybe due to the stretching of capsule and all. So my study reveals most of the times varus at knee in older people is not due to medial joint compartment narrowing, but it is due to collapse of subchondral cancellous bone due to osteoporosis more on medial condyle of tibia, which receives the weight. So collapse of subchondral bone by microfractures of thinned out trabeculae due to osteoporosis gives pain, and patient complains pain of knee, which may be mistaken for osteoarthritis knee. So, so I would like to conclude this that osteoarthritis pain, the pain in osteoarthritis is not always as you think that is the damage of the joint, but the problem is in the bone due to osteoporosis and also sarcopenia, which is unable to take the loads. So load directly falling in the bone, and that is causing the microfractures of the subchondral bone and leading to pain. So cartilage damage occurs only after the secondary to the changes in the bone, the the ligaments, and the muscles wasting and all. So I would like to conclude that the osteoarthritis knee pain is not the mainly the joint damage, but it is due to the porotic bone that is getting collapsed and giving pain. Our intraosseous tension is increasing and it is giving pain. Thank you.